Good afternoon, all of you. On behalf of Abhilashi University, I, Dr. Akriti Guleria, is here to give an informative presentation on the topic Healthy Life by Proper Hand Hygiene. I hope you all will be benefited with this innovative presentation. So let's start the presentation. So the topic of this presentation is Healthy Life by Proper Hand Hygiene. We should make hand washing a healthy habit. So the prime focus of this presentation means the objective of this presentation is the maintenance of healthy life by proper hand hygiene. Means we have to maintain a healthy life by proper hand hygiene. And taking you through the who, what, where, why, when and how of hand hygiene means the main objective of this presentation is to tell you about that these points about that who, what, where, why, when and how we have to use hand hygiene and reviewing of some important points to improve your hand hygiene practice. In this presentation, we will discuss the important points that how we can improve our hand hygiene practices. And when this presentation will be at its end, we will be able to identify who should practice hand hygiene, describe what hand hygiene is, identify where hand hygiene practice should take place, explain why hand hygiene is important, describe when hand hygiene is to be performed, describe how to perform hand hygiene using various methods, and describe tips for success for effective of hand hygiene. Means at the end of this presentation, you all will know about these points who, what, where, why, when, and how. These are the important points, the who, what, where, when, how, and why. These points you will know at the end of the presentation. You all will understand these points about the hand hygiene. Now, what is hand hygiene? We will start with hand hygiene. That what is hand hygiene? Hand hygiene includes cleaning hands with soap and water. So what is hand hygiene is? It means cleaning of hands with soap and water or alcohol based hand rub in order to remove germs, also known as microorganisms. We can also use alcohol based hand rubs instead of soap and water. Nowadays we are using alcohol based hand rubs in order to remove germs. Germs means microorganism. It can be bacteria, it can be viruses. These all are microorganisms, fungus. So the hand hygiene includes cleaning of hands with soap and water and alcohol based hand rubs. Now, who should practice hand hygiene? Means that which persons should practice hand hygiene. So everyone should practice hand hygiene. It is important for everyone to practice hand hygiene. Hand hygiene is important not only for healthcare providers, that everyone needs to be practicing appropriate and effective hand hygiene regardless of work settings. This doesn't mean that only healthcare providers or nurses or doctors should practice hand hygiene, but everyone should practice hand hygiene at homes, at schools, everywhere. We should practice hand hygiene. Where should you perform hand hygiene? Where means which places? In which places we should perform hand hygiene? Busy healthcare providers need access to hand hygiene products where patients or patient environment contact is taking place. means busy healthcare providers, means in the hospitals where we treat patients. So there we should perform hand hygiene. And also in hygiene is also important in all work settings like acute care, long-term care facilities, means hospitals, dispensaries, communities, and corporate sites, means offices. Providing alcohol-based hand rub at the point of care is an important system support to improve hand hygiene. In workplaces, we also use sanitizers or alcohol-based hand rubs. So it provides protection against microorganisms. So this enables healthcare providers to quickly and easily fulfill the five movements of hand hygiene. Now you can see here points of care. The first picture, you can see the patient. Somebody is caring for his mother. She is a patient. So she is in contact with the patient. So she should take proper hand hygiene. In the second picture, you are seeing the healthcare provider. Somebody is sick, and these are the healthcare providers. So they should also take care of the proper hand hygiene. Care involving contact. In this picture, you can see the CT scan or MRI she is doing. So she should also take the proper hand hygiene because she is in contact with the patient. Next is why. Why do we need to learn about hand hygiene? Why it is important? Why it is important to learn about the hand hygiene? Because it is the important way to prevent the spread of germs. If we are doing proper hand hygiene, it is the most important way to prevent spread of germs and microorganisms. Hand hygiene keep you healthy by reducing the number of germs on your hands and helps to reduce the spread of germs to your family, friends, co-workers, patients, residents or clients. So if we are doing proper hand hygiene, proper hand washing with soap and water or sanitizer, it will reduce to spread it will reduce the spread of germs with our family members, with our friends, co-workers, patients, and with the family members, residents, and clients. Using appropriate hand hygiene prevents contamination of the patient's, clients, or residents' environment. Same thing that with if we are properly doing hand hygiene, it will prevent contamination of the patients and patient's environment, workers, doctors, nurses, etc. The next is when. That is, when do you perform hand hygiene? That when we have to wash our hands, when we have to use sanitizer. So there are five movements. There are total five movements when we can use hand hygiene performance, or hand hygiene is performed within the five movements. These five movements are: first is before initial patient or patient environmental contact, or environment contact, means before initial patient or patient environment contact. Before we are meeting with the patient, and after meeting with the patient, we should wash our hands. Second, before aseptic or clean procedure, if we are performing any clean procedure, if we are cleaning any cuts or wounds of a patient, then before we have to wash our hands. Third, after body fluid exposure risk. After body fluid exposure risk means that after we are taking any sample from a patient, we are getting contacting with their fluids, example blood. So it's third point that after body fluid exposure we should wash our hands. Then after patient contact, after contacting with the patient, after touching the patient, we should wash our hands. Then fifth is after patient environment contact, all the things around the patient is its environment. After patient environment contact, after patient environment contact means the things around the patient, if we will touch it, they can also contain the germs or microorganism, so we will also get contaminated. So after patient environment contact we should wash our hand. Remember, hand hygiene prevents carrying germs into and out of the patient's environment. So, hand hygiene is very important because it prevents the germs into or out of the patient's environment. First, first movement, as I have explained before, these are the 5 movements. Okay, then we will now start with the first movement. First movement is before contact with the patient or patient's environment. So in this picture you can see before shaking hands, if we are shaking hand with the patient, okay. Second picture, before transferring, you are doing CT scan or MRI of a patient, then we should, before in contact with the patient, we should wash our hands. We should clean our hands when entering or before touching the patient. First, we will clean our hands with soap and water or with the sanitizer. Then we will touch the patient or the things around the patient. Like before taking temperature, blood pressure or pulse. And before making someone comfortable in bed, you can see here the nurse is taking the temperature or the doctor is taking the temperature of the patient, or he is checking the blood pressure or pulse. So he should wash his hand before in contact with the patient. This will prevent or protect the patient from harmful microorganisms which are carried with our hands. So first we have to wash our hands and then make contact with the patient or patient's environment. The things around the patient is patient's environment. Patient's room, when we have to enter patient's room, or equipments around the patient, or wheelchair or stretcher, they all contain germs. They all are contaminated because they are in contact with the patient. So we have to clean our hands while entering the room, patient's room, or before touching any object or furniture in the patient's environment. So we should clean our hands while entering the room of the patient and while touching their things, while touching the wheelchair or stretcher or equipments of the patient. Before contact with patient or patient's environment, you can see here home environment. Some patients are at home also, so we have to take care of the patients at home also. So we have to wash our hands before we talk or before we touch or before we enter the room of the patient. In the clinics also or treatment area also, there could be germs in the patient's environment. So we have to wash our hands before entering the room. This will protect the patient environment from the harmful organisms carried on our hands. Our hands could also transfer the germs when we will enter the room. So we have to wash our hands or properly sanitize it, because our hands could also carry germs. Now, second movement. Second movement is before aseptic or clean procedures. As I have told you before, the second movement is before aseptic or clean procedures. So we have to clean our hands before. We have to clean our hands or sanitize our hands before, if we are dressing or touching the open wounds of the patient, if there is a cut or any wound on the hands of the patients. So before touching it, we have to clean our hands. This will prevent the patient's own organisms from entering his or her body. Performing invasive procedures, if we are doing any operations or any dressings on the patient, so we have to clean our hands immediately before cleaning the any patient's wounds or cuts. So it will protect us from the harmful microorganisms. Third movement. Third movement is after body fluid exposure. Body fluids includes like blood, skin, fluid from the skin, pus from the mucus or mucus from the membranes. So these all are body fluids. So we have to clean our hands after in contact with the blood or body fluids of the patients or mucous membrane, and after removal of gloves. All the doctors and nurses in the hospitals uses the gloves, and after removing the gloves we should wash our hands properly, or we have to sanitize our hands. After in contact with the contaminated items, if we are in contact with the contaminated items like needles, syringes, if we are in contact with them, then after the contact we have to immediately wash our hands. So we have to clean our hands immediately after an exposure risk to body fluids and after gloves removal. So we have to wash our hands if we are in contact with blood and any body fluid of the patient during taking the samples in the laboratories, in the clinics, if we are taking samples of blood or urine or saliva. So after that, we have to wash our hands. Clean your hands after invasive procedure, as I have told you before, after invasive procedures. And we have to use tissue to wipe our nose or toilet use. So this will help to protect yourself and the healthcare environment from harmful patient organisms. So we have to use tissues if we have to wipe your nose or after sneezing, after coughing. It's a good practice to use a tissue while you are wiping your nose or you are sneezing or you are coughing. So keep the tissue with you always, as it will protect you from spreading of the germs or microorganisms. Fourth movement, after contact with the patient. After in contact with the patient, clean your hands. So I have told you before that before in contact with patient you have to clean your hands, and after in contact with patient you have to clean your hands. After shaking hand, after transferring any patient from one place to another, after making someone comfortable in bed, or after treating the patient or giving him food or giving him injections, after that you have to wash your hands. This will protect ourselves and the patients and the environment of the patients from harmful microorganisms. We should clean our hands when leaving the environment or after touching the patients. Fifth movement, after contact with the patient environment. Clean your hands. We should clean our hands after in contact with the patient's environment. What do you mean by patient's environment? It means the things around the patient, the room, the equipments present in the room, wheelchair of the patient, stretcher, tables, chairs, which are kept around the patient's bed. These all are patient's environment. So we should clean our hands when leaving after touching any object or furniture in the patient's environment. We should clean our hands after contact with home environment. If the patient is in home, then you are treating the patient, you are giving him food, you are giving him water, you are giving tablets, you are giving injections to the patients. So, before and after, in contact with the patient, at home also, you should clean your hands. Contact with treatment area or clinic rooms. After in contact with any furniture, any equipment which is present in the clinic also, clinic area also, we should wash our hands. By hand hygiene, it will help to protect yourself and the healthcare environment from harmful patients' organisms. So I have explained all the five movements of hand hygiene. So let review the five movements of hand hygiene. So first is before initial patient or patient environment contact. So before we are in contact with the patient, if we are going to meet any patient, we are going to hospital to meet a patient. So before entering his or her room, we have to wash our hands, or we have to wash our hands with with soap and water or sanitizer before aseptic or clean procedures. Second point we have discussed, that is before aseptic or clean procedures. Third point we have discussed, that after body fluid exposures. Body fluid exposures means if we are in contact with blood or saliva, urine after taking the samples of the patients, then we have to wash our hands. After contact with patient, if we are going to meet the patient and we are coming back after meeting the patient, then after meeting we have to wash our hands. After contact with patient's environment, we are entering the room, we are touching door handles, we are touching doors, we are touching bed, chairs, wheelchairs, tables, which are kept around the patient or kept in the patient's room. So after in contact with patient's environment, we have to wash the hands. Wash our hand properly with soap and water or with sanitizers. We have to use sanitizers. So these are the 5 points. We have to wash our hands. Hand washing with soap and proper sanitation are critical for good health. So firstly, after using the washroom, we have to wash our hand properly. Second, before eating, serving or preparing food. Before eating, serving or preparing food. Second point is before eating, serving or preparing food, we have to wash our hands. These points we should practice in our day-to-day life. So after using the washroom, before eating, serving or preparing food, after blowing your nose, sneezing or coughing. Third point is after blowing your nose, sneezing or coughing, we should wash our hands. After touching pets or other animals, in homes we have many pets. So after touching the pets, dogs, cats, etc., we should wash our hands. Fifth point is wash your hands for every reason. This is the most important point, that wash your hands for every reason. Before and after, we have to wash our hands. It will make us healthy, and we should be free from any kind of germs or microorganisms. Next is how to perform hand hygiene. That what is the method, how we can perform hand hygiene. There is a proper technique and which is very important for effective hand hygiene. Without proper hand hygiene technique, we can still spread many microorganisms. So we have to use a proper technique for hand hygiene. In this section, I will tell you about the proper hand hygiene technique. So we can use alcohol based hand rubs. We can use soap and water, or without water when hands are soiled. When our hands are dirty, without water, we can also do proper hand hygiene. So there are three types to how we have to perform hand hygiene and with which. So first is alcohol based hand rub, second is soap and water, and third is without water when hands are soiled. So first is alcohol based hand rub. Alcohol based hand rub is recommended method of hand hygiene in any healthcare settings when hands are not visibly soiled. So we can use alcohol based hand rub, means sanitizers, because they are widely used nowadays. We are using sanitizers mainly after corona. We are using the sanitizers very well. And how we will use alcohol based hand rubs? Apply a dime sized amount, means 2 to 3 ml. Dime size means very small amount, 2 to 3 ml of product into the palms of dry hands. When our hands are dry, we will take 2 to 3 ml of the amount of the sanitizer, alcohol based sanitizer. Rub product into our hands. All of you know that when we will take the sanitizer, we are rubbing our hands palm to palm. Then we will rub our fingertips of each hand, then between around the fingers. Then we will rub our thumb in opposite hands also. Rub back for each hand with opposite palm and rub hands until dry. So we have to rub our hands until it become dry before performing the another task. Do not wipe off. Do not wipe off. After using the sanitizer, after your hands are dried, after using the sanitizer, do not wipe off. We will not wipe off the sanitizer. And this alcohol based hand rub, it is also, its full form is ABHR. It means alcohol based hand rub. It contains 60% of ethyl alcohol or ethanol. So all the alcohol based hand rubs, it contains 60% ethyl alcohol. Ingesting small amount of alcohol based hand rub can produce the same side effect as consuming large amounts of alcohol. So it's not a good to use sanitizer very much. We have to use only soap and water. It's good for hand washing. We should not use sanitizer or alcohol based hand rub because they have many side effects. By using the sanitizers, after using sanitizer, we are eating food, we are touching our mouth, we are touching our face. So these sanitizers are not good. So there are many side effects of using these alcohol based hand rubs because it contains 60% of ethanol. It can cause headache, dizziness, drowsiness, incoordination, nausea, slowed reaction time, slurred speech, unconsciousness, giddiness, etc. So these all are the symptoms, or these all are the side effects of using alcohol based hand rubs. It can also result in brain, liver, and kidney damage. So we will not use much sanitizer or alcohol based hand rubs. We will wash our hands with soap and water. Toxic ethanol levels. So it's one of the side effect is toxic ethanol level. So the best is soap and water. It is a recommended method when our hands are soiled, when these are not properly cleaned. So we will use soap and water. Plain soap is used for routine hand hygiene, while antimicrobial soap is used in acute care, high risk areas. In hospitals or in healthcare centers, in dispensaries, we are using antimicrobial soaps. And in daily routine, we can use plain soaps. So here is the link. You can go through this link to see how we can properly wash with soap and water. All of you know how to wash your hands with soap and water. Here are some steps to wash your hands with soap and water. Wet hands under warm running water. Apply soap and distribute over hands. Rub hands together for 15 seconds to create a good lather, palm to palm. All of you know that when we will take soap, then we have to rub our hands palm to palm for 15 seconds. Then rub the fingertips of each hand in opposite palm, between and around the fingers. Rub each thumb in opposite hand also. Rub back of each hand with opposite palm. Then we have to rinse our hands under warm running water. Pat hands dry with a paper towel. We have to then dry our hands after washing with towel. Turn off faucet using a paper towel. So after washing, we have to turn off our faucet using a paper towel. We have to turn off the tap with paper towel instead of turn off with hands. So we have to turn off the faucet with paper towel. And there is another point, that if our hands are soiled and there is no water, what we will do? If our hands are not clean and there is no water, then what we will do? On such occasions, you may find yourself with soiled hands and no access to running water. When access to hand washing facilities is limited and running water is unavailable, use a moist towelette. You have to use moist towelette to remove the soiling from the hands, followed by alcohol based hand rub. So they are easily available in the markets nowadays, antiseptic towelettes. So we have to keep these packet with us, antiseptic tablets. And when we have no running water, there are some places where there is shortage of water and we cannot get the water. So we can use antiseptic tablets. These are the disposable clothes, small pieces of disposable clothes, one time use. We can use them. And after rubbing or cleaning the hands with the antiseptic tablets, then we can use sanitizers or alcohol based hand rubs. So how can we use these tablets? Remove visible swelling with moist tablets. When we are using the tablet, these are the small pieces of the dry clothes, disposable clothes. Then we have to apply a dime-sized amount of hand rub product into palms of dry hands. Rub the product into hands, then rub the fingertips, between and around fingers, then thumbs, then back of each hand. You all know about these procedures, how to sanitize the hands or how to wash hands with soap and water. These all points. Then rub back of each hand, rub hands until dry before performing another task. Then do not wipe off. Do not clean it. Do not wipe it. Handy tips. These tips are mainly for the nurses or doctors or students which are working in the laboratories, taking samples of the patients. These are some handy tips. So, first is artificial nails, gel nails, or extenders are not to be worn by the staff who have direct patient contact. If any staff is in direct patient contact, their nails should not be large. Artificial nails should not be wear. They should no gel nails, no extenders. They should not be worn by the staff members who are in contact with the patients. Contaminated surfaces or objects should not be touched. We should not touch any contaminated surface or any object, any table, chair around the patient or in the hospitals. Avoid touching your face, especially your eyes and nose. We should not touch again and again our face, our eyes, our nose. From this, the microorganism can enter our eyes also. Through our eyes, it can enter through nose. So we should avoid touching our face, especially our eyes and nose. Fingernails should be kept short. Fingernails should be kept short, no longer than 1/4 inch. It should be not longer than 1/4 inch, means 0.635 centimeter. Nail polish should not be worn by the staff members. It should be removed. Do not top up a partially used hand hygiene product dispenser. If reusable dispenser are used, they must be emptied, washed, and dried prior to being refilled. Hand lotion bottles must not be reused. In homes, also in labs, in clinics, we are using lotion bottles, sanitizer bottle. They must not be reused. After using, you should throw it. It should not be refilled again and again. Include frequently missed areas when performing hand hygiene, such as thumbs, palms, web spaces, under nails, and the backs of fingers and hands. So these are the mostly missed areas where we are not cleaning them properly, like thumbs, palms, spaces between the fingers, under nails. So we should clean them all for healthy hygiene, for proper hand hygiene. Use supplied lotions that are compatible with hand hygiene products and gloves to minimize skin irritation that can occur with frequent hand hygiene. If we are in working in the laboratories or in the labs, we should use gloves. Wearing hand and wrist jewelry is not recommended. If you are a staff, you should not wear any wrist or jewelry or bangles or any such type of things. It is not recommended. So these are some diagrammatical representation that how to hand wash, that how we should hand wash. These are the steps. This is the entire procedure I have told you. This is a procedure of 40 to 60 seconds. So all of you should obey this procedure for healthy hand wash. It doesn't take much of the time, only 40 to 60 seconds. So first of all, we should wet our hands with water, then apply soap to cover the surface, all hand surface. Then rub hands palm to palm. You can see in the picture. So how we should rub hands palm to palm. Then right palm over left dorsum with interface finger and vice versa. Like this, in you are seeing in the third point. You should Wash hand like this, right palm over left dorsum. Then the vice versa. Then palm to palm with fingers. Then backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in the right palm and vice versa. Then rotational rubbing backward and forward with clasped fingers of right hand in left palm and vice versa. Then we have to rinse our hands with water. Then we will dry them with towel. And as I've told you, after drying our hands with towel, you have to turn off the faucet. And we will use towel to turn off the faucet. Now, after performing these 10 steps, your hands are now safe without microorganism or any kind of germ. So now in this presentation, I think that you have remembered these 5M, 5 points, 5 movements. I will repeat these 5 movements again. That before initial patient or patient environment contact. Second movement, before aseptic or clean procedures. Third step, after body fluid exposure. And fourth movement, after contact with patient. And last one, fifth movement, I have told you, after contact the patient environment. So this is the diagrammatic representation. So you are seeing here 5 movements. First, before touching the patient. Second, before clean or aseptic procedure. Third, after body fluid exposure. Fourth, after touching a patient. Fifth, after touching patient surroundings. So these are the references from where I have made this topic, and these are some links. If you want to go through any type of inquiry about the hand hygiene, or you have any question about hand hygiene, so you can go through these links. You can get every material about the health hygiene, proper health hygiene, how we can properly wash our hands, hand washing, how we will do hand washing. Thank you.